Hey, what's going on, guys? John Lee here with another video. So, I had a medical disinformation warning on my YouTube channel for the Needlepoint Jordan Peterson podcast live video that I did the other day. And some of you may have seen that. And so, I just kind of wanted to address that and show you basically what I was seeing on my end. And so, this is my YouTube channel page here. You can see my channel dashboard. I've got a channel violation, active community guideline strike against me, which is fucking rude. Because all I was trying to do was cover the news and go over basically some of the bullshit and call out some of the bullshit when, really there's other major news networks covering the same type of shit. And there was, nothing wrong really with uh, what my video was about. And so I just wanted to show you basically what some of these community restrictions and guidelines are that I may have possibly violated. Because I was certainly interested in knowing so that obviously we could correct the issue. But important notifications, community guideline warning, your content, daily news report, Russia, Ukraine invasion, freedom convoy, COVID-19 restrictions and mandates was removed due to a violation of our community guidelines, February 25th, 2022 at 1:50 a.m. Pardon me. So I'm pretty sure that a lot of what was being shared by these scientists and uh, professionals in that podcast, and that's why I wanted to share that message. But I do want to review the content. I did want to review the content. Um, there may be an issue with your content. It was removed. Begin your review to see it. This is just a warning. If it happens again, they're going to slap me on the wrist, maybe take me down, deplatform me, whatever. We found something that may violate YouTube's guidelines to help keep the community safe. We've removed it. In the next two steps, we'll ask you to take a look at your content and the policy. If you'd like to appeal, we'll be happy to review your content again. Let's begin the review. Take a look at your content, keeping policies in mind. First, review our policies, particularly any listed here, and then check out your content again. You'll want to make sure your content follows all policies, not just the ones identified. Issues found later can also impact your video. The policy that it said that I violated was medical misinformation. Now, this shit just blows my fucking mind because, you know, this is the censorship I feel like is really just nailed me. And, because I was speaking out about, and trying to share real information that, yeah, went against, the norm, but that doesn't necessarily make it, misinformation. It doesn't mean that it's not legitimate. And I just wanted to show that, here I am, uh, February 27th, 2022, they're still using the same guidelines on YouTube for these policies that were like from 2020. So, I may say something that contradicts what was said in 2020. And, but all I'm doing is, calling out, the fallacies and the bullshit of the administration and Fauci and the entire situation. And all I'm doing is sharing a message and a podcast by somebody else, and was doing a live video trying to spread the message. And I can just see that it's the message that's trying to be shut down, not necessarily me. But if I don't, play by the rules, and if I don't, do what I'm told, then, you know, I could be deplatformed or demonetized. And so uh, YouTube doesn't allow claims. So I wanted to know, what the fuck are they talking about? And so this is what it says. YouTube doesn't allow claims about COVID-19 vaccinations that contradict expert consensus from local health authorities or the World Health Organization. And so I'm like, wait, what? Uh, I'm pretty sure everything that was said in that video was transparently and openly accurate, was just a representation of the facts. So I don't know how I could, misinform anybody of anything. If anybody did that, it was, the Biden administration. So I thought, okay, learn more. Here it says, obviously, we're going to click on that. And so I'm like, what is the fucking medical misinformation policy? The safety of our creators, viewers, and partners is our highest priority. We look to each of you to help us protect this unique and vibrant community. It's important you understand our community guidelines and the role they play in our shared responsibility to keep YouTube safe. Take the time to carefully read the policy below. You can also check out this page for a full list of our guidelines. YouTube doesn't allow content about COVID-19 that poses a serious risk of egregious harm. Now, you notice in that last statement it said consensus. So, if the majority, if the majority are the people in charge, basically at the, WHO and the NIH and CDC, if they decide that their narrative and their message is the only one that they want to be heard, I mean, this isn't anything new. I mean, we've been seeing it with, Joe Rogan and pretty much everybody that's, had any kind of question about COVID-19. The fact is, as of today, there is no licensed COVID-19 vaccine. And that should be enough reason for everybody to think twice about mandates on every level. But let's see what else it says. And so I'm like, well, what the fuck are you talking about? What did I say or post or share that was in any way this? Let's see, YouTube, okay. YouTube doesn't allow content that spreads medical misinformation that contradicts local health authorities, LHA, or the World Health Organization medical information about COVID-19. This is limited to content that contradicts WHO or local health authorities' guidance on treatment, prevention, diagnosis, transmission, social distancing, and self-isolation guidelines, or the existence of COVID-19. Note: YouTube's policies on COVID-19 are subject to change in response to changes to global or local health authorities' guidance on the virus. There may be a delay between new LHA/WHO guidance and policy updates given the frequency with which this guidance changes, and our policies may not cover all LHA/WHO guidance related to COVID-19. Our COVID-19 policies were first published on May 20th, 2020. And so, if that hasn't been updated since then, you shouldn't be fucking telling me that my shit's outdated or I'm spreading medical misinformation. I think that that's really a really slanderous type of thing to, portray me as. So, better watch your ass. And, I'm not trying to violate anything. All I'm trying to do is, spread truth and try to make available, the opposite of misinformation. That video, Needle Points, is a complete breakdown. It really points out the fallacies, and it really points out, how we've been, just mind fucked by the government and by all these pharmaceutical companies, and just completely had smoke blown up our ass. And YouTube and the government doesn't like that shit, and so they try to shut it down. That's when you know that you're facing tyranny. What this policy means for you: if you're posting content, don't post content on YouTube if it includes any of the following. So this is what I just really kind of blew my mind. So I thought I would make this video and share it with you guys, because if for any reason you had any kind of opinion or freedom of expression or thought or anything like that, speech, those crazy rights that we supposedly have, this sort of stuff matters. And I just was kind of like, what the fuck? Treatment misinformation: don't you dare say anything about this stuff on YouTube. Content that encourages the use of home remedies, prayer, or rituals in place of medical treatment, such as consulting a doctor or going to the hospital. content that claims that there's a guaranteed cure for COVID-19. So I think it's messed up that, you can't make a video that encourages people to use home remedies or even prayer in place, or rituals in place of medical treatment. They want you to absolutely have to go to the doctor. They want you to absolutely have to, be controlled. They want you to absolutely go through them. It's like, no, you don't really have the right to think and choose for yourself. And, that's a real issue for a lot of people. It's a huge issue for me. Uh, Content that claims there's a guaranteed cure, we know that that's not the case. Content that recommends use of ivermectin or hydrochloroquine for the treatment of COVID-19. Now, we've already heard a lot of podcasts from Joe Rogan and many physicians running their own clinics and practices, who have been shamed and all this shit by the government and by big tech and all these far left extremists. It's bullshit. It's like they're really just, they just can't get their grip tight enough around the fucking American people, and they're just choking the fuck out of them. And it's already been proven, and we've already seen these stories. So, these claims of things, maybe this is just outdated, and maybe this is just a misunderstanding, but I like to call shit out real time. So, let's see, claims that hydrochloroquine is an effective treatment for COVID-19. Categorical claims that ivermectin is an effective treatment for COVID-19. Now, I have not any experience with COVID-19 because we haven't had it. So as far as treatments go, but, I'm certainly open to the idea of an open dialogue. I'm certainly not like, oh, absolutely, don't you dare even bring it up. That's just weird when people start, thinking and saying things like that. So you cannot say that hydrochloroquine or ivermectin is an effective treatment, but you can also not say that claims that ivermectin and hydrochloroquine are safe to use in the treatment of COVID-19. Other content that discourages people from consulting a medical professional or seeking medical advice. So, don't you dare put anything out there that goes against the main narrative of, this agenda. That's really what you're really seeing here. And the fact that these big tech, Google and YouTube and Facebook and all these platforms are, bending, there's some real issues there on whether or not, that censorship should even, these platforms should even have that type of authority. And I think that, they really shouldn't. Prevention misinformation. Now, this to me is kind of, I do touch on shit like that because no one in my immediate household has had COVID. There's 5 of us, 2 adults, 3 kids. And so, we have stayed the fuck away from everybody, and none of us have had COVID, and that has worked. And so you can't act like, that thought process should be eliminated from the equation. When you're pushing for 100% vaccination, when all this shit has just been shady as hell, and you constantly call it a fluid situation, and it's, people's rights are getting taken away, and kids are getting fucked up, and there's all this shit that's going on, but nobody's covering the damage that's being done by this type of shit. They're only worried about 95%, 96% until every single person is vaccinated with an unlicensed vaccine, and then you have no control. You have, you got to have some people that aren't vaccinated, or you have no way to do data and science. Anyways, let's see. Prevention information content that promote. Let's see. Prevention information content that promotes prevention methods that contradict local health authorities or WHO. So, it's just blows my mind that they're basically point blank saying you're not allowed to have another narrative. And so that's a real suppression of the freedom of speech and expression. And I don't think that's right. Claims that there's a guaranteed prevention method for COVID-19. Well, I can guarantee that the method that my family used works because none of us have had COVID-19. So why can't I just speak the truth? if the truth will set me free, as it should set you free. There's a problem with the censorship of truth. And I think that there's a fundamental damage that's being done that can't be undone. And we need to be really careful. As Jordan Peterson would say, it's not good. Please don't castrate me for that one. Let's see. Claims that any medication or vaccine or vaccination is a guaranteed prevention method. No, nothing's guaranteed. Content that recommends the use of ivermectin and hydrochloroquine for the prevention of COVID-19 claims that. So if you've used that medicine and it worked, you're not allowed to share that. You're not allowed to tell the truth. You're not allowed to even share the idea that there might be another truth. Really weird to me. It's really weird. Claims about COVID-19, it just goes on and on. Claims that wearing a mask is dangerous or causes negative physical health effects. Claims that masks do not play a role in preventing the contraction or transmission of COVID-19. Claims about COVID-19 vaccinations that contradict expert consensus from local health authorities or WHO. Claims that an approved COVID-19 vaccine will cause death, infertility, miscarriage, autism, or contraction of other infectious diseases. Claims that an approved COVID-19 vaccine will contain substances that are not on the vaccine ingredient list, such as biological matter from fetuses, fetal tissue, fetal cell lines, or animal products. These are things that you're not allowed to say. It just blows my mind that people would have the authority to do that. Let's see. Claims that an approved COVID-19 vaccine will contain a substance or device meant to track or identify those who've received it. Claims that COVID-19 vaccines will make people who receive them magnetic. Claims that an approved COVID-19 vaccine will alter a person's genetic makeup. Remember, these are all things that you are not allowed to say on YouTube. So I am not making these claims. I'm just sharing the truth, fact of what YouTube's policy is. Claims that COVID-19 vaccines do not reduce risk of contracting COVID-19. Claims that any vaccine causes contraction of COVID-19. Claims that a specific population will be required by any entity except for a government to take part in vaccine trials or receive the vaccine first. I don't understand that. Like this, by the time you get to the end of this list, this is so fucking confusing. I don't know why people can't just tell the truth and that be any problem for big tech. I mean, it's obviously the problem. People get exposed. Content that promotes the use of unapproved or homemade COVID-19 vaccines, instructions to counterfeit vaccine certificates, or offers of sale for such documents. You're not allowed to talk about anything like that. Diagnostic misinformation. Content that promotes diagnostic methods that contradict local health authorities or WHO. Claims that approved COVID-19 tests are dangerous or cause negative physical health effects. Claims that approved COVID-19 tests cannot diagnose COVID-19. I mean, how do we know this shit? You know what I'm saying? And why can't we talk about it? I say I'm looking for another platform, and that's the God's Honest Truth. I've been trying to hit 1,000 subscribers, and I like YouTube, but I'm looking for a more free, Rumble's looking pretty good, sounding pretty good. It doesn't really look as good as YouTube. And so I'm really looking for another platform, to be honest, where I don't feel like I'm getting this type of censorship, especially when I'm sharing the truth. Transmission misinformation. Content that promotes transmission information that contradicts local health authorities or WHO. Content that claims that COVID-19 is not caused by a viral infection. Content that claims COVID-19 is not contagious. Content that claims that COVID-19 cannot spread in certain climates or geographies. Content that claims that any group or individual has immunity to the virus or cannot transmit the virus. Social distancing and self-isolation misinformation. Content that disputes the efficacy of local health authorities or WHO's guidance on physical distancing or self-isolation measures to reduce transmission of COVID-19. See, pardon me, you can see how much they're talking about stifling the freedom of speech and sharing the truth and sharing other ideas and open dialogue. But what they're not sharing is the damage that, and what they're not talking about is the other part of the narrative that's really, how this has all affected so many people and damaged so many people in such a negative way. They're so worried about the control and the compliance, and it's gotten so out of hand that it's fucking ridiculous. Let's see. And acting like, anything other than what we say is absolutely wrong, and that's just not how science is done. Let's see. Denial that COVID-19 exists. Why can't I deny something exists? You know what I'm saying? Like, who the fuck are you to tell me what I can and cannot think or say or do? Just on every fucking level. That's really where I stop saying, hey, I don't know how many more videos I'm going to do for YouTube. You guys are using hundreds of my videos to run ads and all this shit, and I'm not getting anything. I'm not getting anything. I'm not getting paid one penny by YouTube at all. Never have in 6 years. Never received one penny. So I'm just sharing the truth and the fact of the matter because I want to spread the message because that's the right thing to do. And I'm hoping at some point, yeah, somebody gonna start paying me something to do this shit. You know what I'm saying? Because this is the bullshit that's gonna fucking ruin our country, and it is ruining our country currently. Claims that people have not died or gotten sick from COVID-19. So you can't say that. Claims that the virus no longer exists or that the pandemic is over. So you're not allowed to say, oh, finally the pandemic's over, which we know the numbers are going down and the pandemic is pretty much over. So why can't I say that? Why can't I talk about it until you allow it? See, I don't understand that shit. Claims that the symptoms, death rates, or contagiousness of COVID-19 are less severe or equally as severe as the common cold or seasonal flu. I think we already know the consensus on that. Claims that the symptoms of COVID-19 are never severe. Wow. I mean, this is one hell of a censorship list. If you ask me, here are some examples of content that's not allowed on YouTube. Denial that COVID-19 exists. Claims that people have not died from COVID-19. Claims that any vaccine is a guaranteed prevention method for COVID-19. Claims that a specific treatment or medicine is a guaranteed cure for COVID-19. Claims that hydrochloroquine saves people from COVID-19. Promotion of MMS, Miracle Mineral Solution, for the treatment of COVID-19. Claims that certain people have immunity to COVID-19 due to their race or nationality. Encouraging taking home remedies instead of getting medical treatment when sick. Discouraging people from consulting a medical professional if they're sick. Content that claims that holding your breath can be used as a diagnostic test for COVID-19. Videos alleging that if you avoid Asian food, you won't get the coronavirus. Videos alleging that setting off fireworks can clear the air of the virus and will prevent the spread of virus. Claims that COVID-19 is caused by radiation from 5G networks. Videos alleging that the COVID-19 test is the cause of the virus. Now, that's crazy because that's just fucking crazy because people need to have these conversations. How do we know that they're not unless we question them and then we prove them? We've got to have science. We've got to have evidence to support our claims. You can't just tell people they can't think and talk and have open dialogue. It's nuts. Videos, let's see. Claims that countries with hot climates will not experience the spread of the virus. Videos alleging that social distancing and self-isolation are not effective in reducing the spread of the virus. Claims that wearing a mask causes oxygen levels to drop to dangerous levels. Claims that masks cause lung cancer or brain damage. Claims that wearing a mask gives you COVID-19. Claims that the COVID-19 vaccine will kill people who receive it. Claims that the COVID-19 vaccine will be used as a means of population reduction. Videos claiming that the COVID-19 vaccine will contain fetal tissue. Claims that the flu vaccine causes contraction of COVID-19. claims that COVID-19 vaccines are not effective in preventing the spread of COVID-19. So that's a really good one, because now we know that being vaccinated doesn't prevent the spread of COVID-19. So why can't I talk about that? Is it because your policies are outdated? Why am I even getting this message? Why is this a medical misinformation? If I'm sharing news that's current and it says this, why you're such a huge fucking big tech? Oh, you got your shit together. You got so much control over everything. Why am I getting a medical misinformation fucking thing on actual, you know, breakdown timeline from scientific professionals? And I'm just sharing their message. Why am I getting a fucking strike on my channel for sharing the truth? Like, I kind of expect an apology, to be honest. Videos claiming that the COVID-19 vaccine will contain fetal tissue. Claims that the flu vaccine causes contraction of COVID-19. Claims that COVID-19 vaccines are not effective in preventing the spread of COVID-19. Claims that the COVID-19 vaccine causes contraction of other infectious diseases or makes people more vulnerable to contraction of other infectious diseases. Claims that the COVID-19 vaccines contain a microchip or tracking device. Claims that achieving herd immunity through natural infection is safer than vaccinating the population. Claims that COVID-19 never causes serious symptoms or hospitalization. Claims that the death rate for the seasonal flu is higher than the death rate of COVID-19. Claims that people are immune to the virus based on their race. Claims that children cannot or do not contract COVID-19. Now there's just so much to this. Like, this is unfucking believable. It's like you can go to this fucking extreme and this length to make sure that I don't say any of that shit. But when I share the truth, you can give me a medical misinformation strike. Fuck you. You know? Fuck you. That's offensive. It's offensive. That's all there is to it. Claims that there have not been cases or deaths in countries where cases or deaths have been confirmed by local health authorities or the WHO. Oh, I'm trying to wrap this up. You have to bear with me. Hopefully there won't be much more. I don't think there is. You can see there's a misinformation policy section and a bunch of other shit on the other side that you guys can check out if you really want to, if you're a creator. But I just feel fucked, like slapped in the face, like, and stifled. And as an expressive creator, I don't fucking like that shit. It makes me stop everything that I'm doing and make this fucking video to show you what these fuckheads' policies are and how fucking ridiculous they are. And basically, tell you what I think about it and what I'm going to do about it, which is I'm going to make this fucking video. I'm going to share it. I'm going to keep spreading the goddamn truth and, be as trans fucking parent as possible. And, if that's not fucking good enough for YouTube, then fuck them. The educational and documentary, scientific, or artistic content. We may allow content that violates the misinformation policies noted on this page if that content includes additional context in the video, audio, title, or description. This is not a free pass to promote misinformation. Additional context may include countervailing views from local health authorities or medical experts. We may also make exceptions if the purpose of this content is to condemn, dispute, or satirize misinformation that violates our policies. We may also make exceptions for content showing an open public forum like a protest or public hearing, provided the content does not aim to promote misinformation that violates our policies. All I was trying to do was have an open discussion, which is why I chose to have a live video. I wanted to have an open discussion. I'm promoting dialogue. I'm promoting talking. I'm promoting difficult conversations. Yes. That's what it's all about. And that's what we need to be doing. And so that's what we need to be doing. And so for this, it says, it'll make exceptions it's calling exceptions to other, health, countervailing views. It's like, so you're specifically saying, you know, we that just having an opposing view goes against your guidelines. Is basically what the bottom line is here. And that just fucking blows my fucking mind that a platform this big, and Google and YouTube, these media tech giants, could have this much fucking power and control, just that much power over the censorship of billions of people. Just blows my fucking mind, and I think something needs to happen about it. What happens if the content violates this policy? If your content violates this policy, we'll remove the content and send you an email to let you know, which is what they did. I tried to find the email, I couldn't find it. If this is your first time violating our community guidelines, you'll likely get a warning with no penalty to your channel. If it's not, we may issue a strike against your channel. If you get 3 strikes within 90 days, your channel will be terminated. You can learn more about our strike systems here. We may terminate your channel or account for repeated violations of the community guidelines or terms of service. We may also terminate your channel or account after a single case of severe abuse or when the channel is dedicated to a policy violation. You can learn more about channel or account terminations here. Man, I just feel like that's extremely hostile, and I don't like it. So that's my video on this bullshit. I got slapped with a medical misinformation strike because of my call for an open dialogue on the COVID-19 and the medical misinformation that was being put out there, and the Jordan Peterson Needlepoint podcast. And we didn't even end up having a discussion. There was no dialogue that was had, and it was still removed just for me sharing the message. And so I think that's fucked up. I'm John Lee. If you like videos like these, fucking hit this like and subscribe button, or don't. Go fuck yourself.